Moving on to the final case study, which will be focused on nutrition, and this session will be moderated by Professor Monica Wang. Professor Wang is an assistant professor in the Department of Community Health Sciences at the Boston University School of Public Health. Her research interests include addressing racial, ethnic, and socioeconomic disparities in obesity and chronic diseases, as well as the design, implementation, evaluation, and dissemination of programs that promote healthy eating and physical activity among underserved populations. She currently sits on the advisory committee of the Massachusetts Legislative Task Force to reduce sugary drink consumption and promote water consumption. Please join me in welcoming Professor Wang.
Thank you. I'm very excited to introduce our panelists for the nutrition subsection, and I'll be introducing them each right before their presentations. First, I'm very excited to welcome Dr. Dariush Mozaffarian, a cardiologist, Jean Mayer Professor of Nutrition and Medicine, and Dean of the Tufts Friedman School of Nutrition Science and Policy.
Great to be here. Thank you to BU and for inviting me and for hosting this conference. I want to talk a little bit about a concrete example of, I think, success for having a academic private sector collaboration in nutrition. First, I just want to really highlight, why this is important. Nutrition is, I think, and our food system is the single biggest challenge and opportunity we face right now in public health. It's the single leading cause of poor health, mostly from chronic diseases, but also, of course, from hunger and micronutrient deficiencies. It's a massive issue for sustainability of the planet. 1/3 of greenhouse gas emissions, 70% of water use, 90% of tropical deforestation, stress to the oceans, huge problem for disparities. But there's also incredible economic problems from all of these things. The healthcare costs alone are crushing the U.S. Government's budgets, both states and federal, and this is happening in middle-income countries. In middle-income countries, chronic diseases are happening at young ages, often people who are in their 40s and 50s, and that leads to real problems for family income. And so I think that the economic issues are really crucial, because if you want to talk about public-private partnerships, food is where there's enormous money to be made by fixing the problem, right? Whoever can figure out how to fix the problem and have healthier, equitable, sustainable food that improves health and lowers healthcare costs is going to make a lot of money. There's trillions of dollars to be made. And so this is different than tobacco, at least combustible tobacco and alcohol, in that there is a very healthy product that can be made. And so this is where I think it's really important to highlight. I'm just going to show you a couple of slides really quickly. This is from the US, but this is almost true of any country in the world. If you look at causes of death along the bottom axis, diet is now the single leading cause of poor health in almost every nation in the world. These are several hundreds of thousands of deaths every year. These are the costs, estimated costs just in the US, direct and indirect costs. Cardiovascular disease, over 300 billion, type 2 diabetes, over 300 billion, and obesity-related conditions, 1.4 trillion. We throw around those numbers all the time, billion and trillion, but we need to kind of put it in context. So what's the combined budget of the CDC, FDA, and NIH, just to put it in context? So anyway, it's about 40 billion, right? So all of the government spending on public health organizations, NIH, CDC, and FDA is about 40 billion. The Republican tax cut that was so controversial and is putting us in huge debt and deficits for decades to come, how much is that per year? Massive tax cut, right? One of the biggest ever, right? How much is that? It's about 100 billion a year, right? So just preventing about 1/3 of type 2 diabetes pays for the tax cut, right? We know how to prevent almost all of type 2 diabetes if we actually implemented a healthier food system. And this is the rise in Medicare and Medicaid just in the federal budget, not counting the state budget. This is not a chart of like 30 decades. This is just the last 7 years, right? Look at the rise in Medicare and Medicaid costs. It's $1 in $4 in the federal budget. I mean, we are on a completely unsustainable course, and this is where, again, there's money to be made and businesses need to play a role. Now, food companies can play a role, and we can talk about that in the panel discussion, but it's not just food companies. Any business that is in the business of wellness or their own employees' wellness can make money by having a healthier food system. And I want to talk about the work that Tufts is doing with John Hancock. So John Hancock, a couple of years ago, partnered with Vitality in South Africa to launch a product, a Vitality product in the United States called John Hancock Vitality, because they were doing their actuarials. Life insurance companies are real experts at understanding what's causing people to die, and they saw from 30 or 40 years ago massive shifts away from infectious disease and accidents toward chronic diseases. And lifestyle was causing most of the deaths among their clientele, and diet was 2-to-1 over physical activity and tobacco as the problem. Diet was the big problem. And they said, we need to make our life insurance clients live longer, and if we'll make more money because they'll live longer, we can return some of the savings to them through programming. And so they launched Vitality, which rewards their clients for healthier living. Now, they launched it 2 years ago. They launched the tobacco and physical activity components first. They were relatively straightforward. If you don't smoke, you get benefits, you get premium discounts, you get other rewards. If you wear an Apple Watch or a Fitbit or you go to the gym, you get benefits. But they delayed launching the nutrition because they were really confused about what they should do, what the priorities should be, how they should implement it, and how to answer all of their clients' questions. They did say, this is the white paper that they put out about their healthy food program when it was launched with Tufts. They said traditionally the role of improving diets has fallen to the government and the healthcare sector. Public health policies have focused on taxes, regulations, and educational campaigns. While these have been effective for measures such as tobacco control and infectious disease, success has been limited when it comes to nutrition. You can't tax your way to a healthier diet, right? You can tax soda, maybe junk food, but what about getting people to eat healthier? And so they said the complex and multifaceted nature of improving people's diets requires broad-based approaches. The private sector is in a unique position to encourage better nutrition through the provision of financial incentives. And then the confusion, as I said, hit them, and so they didn't know what to do. And so we started talking, and we said, we can be here and be a resource for you to be sure your science is sound, to answer the questions of your clients, to be sure that you're doing the right thing. Because there's unbelievable confusion right now about what's a healthy diet. Policymakers are focused on fat, sugar, salt, and calories, and the public is focusing on a completely different list about clean labels, or whether food's organic or whether it's local. And most of the stuff in both columns is actually not that important for health. Salt is a clear exception. There's way too much salt in the food supply, and the UK has shown that can be reduced through government policy. Sugar is a problem if you combined it with starch. I think just focusing on sugar alone could increase starch in the food supply, and there's way more starch than sugar in the food supply, so I'm a little bit worried about the focus on sugar. The focus on fat and total calories is completely incorrect, right? And so we need more fat in the food supply, not less fat in the food supply, especially healthy fats. And focusing on calories gives people the message that 600 calories of unhealthy food is better than 800 or 900 calories of healthy food, and that's incorrect as well. So most of this is actually incorrect, and the public and policymakers are confused. So here's what we're doing in this public-private partnership. We're really vetting and reviewing the science to be sure that the healthy food program is evidence-based. We're providing trusted content. One of the things that comes up with nutrition is, again, people have questions. You tell them not to smoke, you tell people to exercise. They might have a couple of questions, but they get it. You tell people to eat healthy, they say, well, what does that mean? Should I have a shake for more in the breakfast? Should I skip meals? What about intermittent fasting? What about bone broth? What about coconut oil? Should I take supplements, right? The questions come on. And John Hancock said, wait a minute, we can't handle these questions from our clients. And so we provide a monthly newsletter, the Tufts Health and Nutrition Letter, to all 1.8 million of their life insurance clients. We review the content that they put out themselves, Newsletter Magazine. We provide expert faculty talks and webinars for the employer and for the clients. And they've really latched onto this, John Hancock, for their own employee wellness efforts, and we're advising them and helping them with their own employee wellness efforts. And we're also doing joint advocacy. We're going to the Hill and we're going to DC with the John Hancock CEOs to talk to congressmen about why business should be part of the solution for healthier food. So it's really been a great partnership. And I'll skip slides for time. And I'll say, and one of the aspects of the program that John Hancock does, which I think is really great, is they actually pay people, they give money for buying healthier food. They have a really nice technology platform, which is run by NutriSavings, which is a worksite wellness company in Massachusetts. The technology platform is linked to Shopper Rewards cards, and so whenever you buy anything with your Shopper Rewards cards, it automatically gets linked to your John Hancock Vitality account, And you immediately get a score, a shopping score, based on the healthfulness of what you purchased. You get other options. You get points and benefits. And any food that scores above a 70 out of 100 on a nutrient profiling system, which we reviewed and is actually very good, they give cash back. And so John Hancock pays up to $600 per year per person to eat healthier. And when I first heard about this, I said, well, so you guys are paying this $600 cash back. Are you splitting it with the food companies? Did you kind of come up with these? Because almost every major grocer in the United States is part of this program, Walmart, others. And they said, no, we're paying for it. Like, we've done the math. We'll pay $600 for them to eat healthier. We will make money from that because they will live longer. So there's, again, millions of dollars to be made, billions of dollars to be made through a healthier food system. And John Hancock's program, as I said, was launched 2 years ago. The healthy food piece was launched a year ago. It's been so successful that just last month, John Hancock announced that every policy they sell to all of their stakeholders in the future is going to be a vitality program. This was one product, but it's going to go across their entire portfolio. So this is a 156-year-old life insurance company doubling down on healthy lifestyle and on healthy nutrition. And it's really important because right now the public is confused by messaging from policymakers and industry about calories and fat and saturated fat. And all the products on this page are not healthy, but people think they're healthy because of this messaging. And so having sound science and incentives and technology to lead to healthier eating can really make a difference. This is our Tufts Health and Nutrition Letter, which has been customized for John Hancock. This comes out every month, and it answers key questions in sort of layman-friendly terms. This is actually an example of research that we've done with the NutriSavings platform. We analyzed 2 million shopping trips among 25,000 Americans who are regular shoppers in the program across the 48 states. This is the shopping score. There's 2 peaks here, which are just from enrollment, so ignore those peaks. What was really interesting, this is shopping score higher is better over 3 years. We saw sort of what looked like randomness, but wait, it's not random. At the same times in the year, there are these drops in the shopping score. And so that's quite interesting. And what do you think those times are? This is Christmas. This is Thanksgiving. This is Easter and the Super Bowl. This is Halloween, right? So every year, Easter, the Super Bowl, Thanksgiving, Halloween, and Christmas, people's shopping scores drop, right? This is very unique data. There's really no other data I've seen which shows the quality of purchases over time within people. And the other interesting thing, which we've confirmed and we've submitted this for a paper, is that the shopping score among the same shoppers does increase over time. So this isn't dramatic. I mean, the scale here is 50 to 70. This isn't the whole 0 to 100 scale. But the program works. People do improve the quality and healthfulness of their purchases over time. So I just mentioned there's been a remarkable response and engagement to a focus on healthy lifestyle by John Hancock. NutriSavings and Walmart are partnering with them. Apple Watch, Fitbit, and Garmin, REI. They've just launched Healthy Mind, so they're going to give rewards for people doing meditation. Amazon Prime and CVS Pharmacy and Hotels.com have just partnered with John Hancock. John Hancock has gone from one passive engagement with their clients once a year, which is getting their bill or their statement, to 43 engagements with their clients per week, right, with this program, right? So you can see why, from a business sense, the customer base is really responding to healthy lifestyle and to getting clear incentives for healthy lifestyle. So I think this is the real model for companies, all sorts of companies, to engage in healthier lifestyle. There's a series of other Best Buy policies, and there's work we're doing for advocacy that I'm going to skip for time because I'm running out of time. I want to stick to my 10 minutes. But my main point I want to make is I think that the fundamental role of academics to partner with the private sector is to be sure that what is being done in policy, whether it's government policy or worksite policy or business policy, is truly based on sound science. And that's relatively clear for tobacco and physical activity and other things. It's not relatively clear for nutrition. And a lot of the problems we face today are because a lot of the things that are actually being done, both by business and by government, to address the nutrition crisis isn't actually based on sound science, but has been based on science from 30 years ago, focusing on fat and calories and other sort of reductionist approaches. So I think this is the real role of academics and should be the role that we play. So thank you very much, and look forward to the panel discussion.
I'm very pleased to introduce our next panelist, Dr. Sherry Pagoto, a professor in the Department of Allied Health Science at the University of Connecticut. She is also a licensed clinical psychologist and director of the UConn Center for mHealth and Social Media. At the national level, she serves as president of the Society of Behavioral Medicine. Welcome.
Okay, thank you. I actually agree with my co-panelist entirely, so I hope you weren't waiting for a debate here. But, but I want to kind of talk about this from a little bit of a different angle. I'm a behavioral scientist, and in some ways in behavioral science we have a little bit of a cautionary tale as it pertains to being overly conservative about boundaries between academia and industry. And so I'm going to talk a little bit about my personal experience interfacing with industry and what we're doing at the Society of Behavioral Medicine to sort of actually forge stronger connections, because we haven't typically done that. So in behavioral science, historically, we haven't really had so much of an industry counterpart because we really focused on developing behavioral, non-pharmacological interventions. So we don't have this long history of working with drug companies and that sort of thing. So in some ways, some of this is new to us. However, with the kind of dawn of the digital health industry, there's been an enormous opportunity for us to inform industry as it pertains to all of the sort of technology-based innovations around behavioral management of obesity, diabetes, any health condition you can think of. So my area of work has been really focused on obesity management, so I'll be talking a lot about that. So in terms of my disclosures, and this will kind of walk you through my relationships with industries, I have interfaced with Apple, Weight Watchers, Sears, Facebook, Johnson & Johnson, Empower Fitness, Lifespan, and Provant Health as an advisor or speaker. I am currently a scientific advisor for Fitbit and a company that is actually local to Boston called Firefly Health. These companies have not funded my research, but my research is currently funded by a number of institutes at the NIH. So I first kind of interfaced with industry through a paper that I wrote. And I'm going to tell you just kind of the story of this paper. I started to see that lots of mobile apps coming out into the market, obviously within the last 5 or 10 years, and noticing that many of them actually reflect quite a narrow range of behavioral strategies. So the weight loss apps were of particular interest to me, and it became of interest that so many of them seem to be very narrow in terms of what we know around how to manage one's weight through behavior change. And so I did a review of the most popular apps, and basically what we found was that apps included on average about 19% of behavioral strategies we know to be effective and part of a gold standard lifestyle intervention for weight management. So the Diabetes Prevention Program, which some of you may be familiar with, is kind of our gold standard lifestyle intervention for weight management, and that was sort of the criteria by which we used to compare these apps. And so we found that they actually reflected very little of what we know works. In fact, the highest rated app only had about 65% of behavioral strategies we know that work. So we got this published, and it got a little bit of press, and that's actually how I ended up interfacing with Apple, because one day they called me up and said, "We heard about your paper. We'd love for you to tell us more about, behavioral science and health." And so I visited them, and we had great conversations about that. Not everyone was thrilled with my paper, though. We got a letter to the editor from the CEO of the Noom company, who felt like we unfairly characterized their app. And basically what they said was, "You guys didn't use our app long enough. If you use the app for a long period of time, you would have seen that more behavioral strategies came about." So we thought, oh, okay, well, let's look into this. And what we found was that if you do use the app for a long time, or like this version of the app, what would happen is little tips would pop up from time to time, giving the user little bits of advice, which they considered behavioral strategies. We didn't consider those things behavioral strategies because a behavioral strategy is really a process by which you're kind of teaching somebody something, you're working through what the challenges are for them to implement that strategy, and it's a real back and forth. It's not just a tip. And so we made a retort to that effect that, even though you guys had this extra content, we actually don't consider that a behavioral strategy. And so it became clear to me in this exchange that how industry thinks of behavior change is very different than we think of behavior change. And I'm not blaming them for that. I kind of blame us for that because we haven't really educated them about what is behavior change, what is the science of behavior change, what is a behavioral strategy. It's not just a tip. We don't just go around giving people tips. We actually have a process of counseling that we know is effective. So this was an interesting experience. And it really kind of made me realize that in behavioral science and academia in general, we're sort of on this island. And it's kind of not the most attractive island because we made up our own language and we only talk to each other. And so nobody really comes and visits this island because it's just not very hospitable. And we're kind of learning a whole bunch of things. But we really need a way to take the information that we're learning and bring it to the mainland. And as behavioral scientists, this is something I think we really need to do better because so many different players are getting into the space and calling themselves experts in behavior change. And that's to our detriment. So meanwhile on the mainland, there's this digital health industry that's worth hundreds of billions of dollars, pushing out products to millions and millions of users, Fitbit being one of them, 27 million users. MyFitnessPal, probably the most popular weight loss mobile app, over 19 million users now. So to what extent do these reflect behavioral science is a question. And that's one gap that we're hoping to be able to close as much as we possibly can. So I certainly appreciate that a lot of academics are nervous about interacting with industry. And we've had a lot of interesting examples at this conference, which have been wonderful to hear about. But I also want to encourage people who might be nervous about going as far, maybe as some of our speakers, that there are other ways you can interact with industry and to hopefully inspire you to think of some way that you can be communicating or interacting with industry to whatever is your comfort level. And this can take many forms, whether it's engaging in social media or blogging or writing articles in industry-facing outlets, consulting for industry. Obviously, that does come with conflicts of interest, but so that wouldn't necessarily avoid that sort of thing. Like just writing would be conference events where you're bringing your conferences together, or you're attending their conferences and speaking in their language when you're presenting and inviting them to your conferences. Training opportunities. So are you bringing any sort of science or training to the industry so that they can learn some of the skills that you feel like would be useful as they're developing their products, as well as preparing a workforce for industry. How much in academia are we training people to be academics versus going into other sectors? And there's just kind of this dirty little secret in academia that if you're a graduate student in many areas of academia and you say right off the bat, I'm interested in an industry job, I think there are a lot of advisors who would kind of feel maybe lesser about you or like you're going to sell out or something like that. So I think that's something that we really need to that needs to end in academia as soon as possible. And finally, research collaborations, doing science together, as we've been talking about all day. So the Society of Behavioral Medicine has joined with Personal and Connected Health Alliance to kind of solve this gap or to close this gap. And this, I think, is a nice case study of how professional organizations can sort of move the needle on this as well. So we have designed some cross-conference events where we come to their conference and have our leaders present. And we have them come to our conference. We have speed networking opportunities for students and trainees who are looking for jobs, training workshops and panels. We're developing an internship and jobs network to connect industry professionals with behavioral scientists so that we can have more behavioral scientists moving into the industry sector. We're also developing an industry-facing micro-credentialing program to teach people in industry the science of behavioral change so that they have some strategies and skills that they can immediately apply in their work. So you don't have to go get a master's degree or a PhD in psychology to learn how to change behavior. We're also developing graduate training competencies for industry track students and hoping to encourage graduate training programs to adopt these competencies and encourage their students to explore this track. And finally, we are doing some social media where we blog on their blog, which has an industry-facing audience. So I think what we risk by not engaging in any way with industry, and like I've shown there's so many different ways we can engage, is that our science is not being applied to innovations that are widely disseminated. And I'll use behavioral science as kind of the current example, is that we have all kinds of products out there around behavior change that are not necessarily informed by the science. And so now that's something that we're going to have to catch up on. There are enormous opportunities, obviously, to conduct research on industry's data. That's the kind of data that we would just have a really hard time collecting in an academic type setting. And finally, as an academic, this is very important to me, we're really sacrificing career opportunities for students when right now in academia there aren't enough positions for all of the students that we're training. And so on that note, I'm going to make one last point, actually. I'm going to go back to the Noom company, which I have no relationship with, and they probably don't even like me after that exchange. But I just wanted to say a positive thing about them is that their app now has a coaching program that is completely based on the diabetes prevention program. And if I were to review the app, I'm sure I would probably get flying colors. And so there has been some movement in the digital health industry around adopting more behavioral science with coaching and more sophisticated strategies. And so I think that's great news. So I just wanted to not end on being negative about Noom because I think they're doing a great job. But I will end on that note and we can continue with the panel. Thanks.
Great. Can everybody hear me? Okay, great. So we'll get the discussion started with a warm-up question and then we'll open it up to the audience. But I'd like to hear from both of our panelists about your thoughts on, given that there is quite a lot of misinformation and confusion from the public and from industry on how to best advance public health, population health through nutrition and behavioral science, where do you see the future in terms of directions and what are key concrete steps that academia can take and industry can take?
I think that's a great question. I'm happy to, I'll just make kind of a plug for science communication there. So I think nutrition is a space where there is so much misinformation, and you talked about that in the beginning of this panel. And I think part of that is because we haven't been communicating what we know in the science to the public, so there's so much confusion about nutrition. We sort of leave it to the media, and the media loves to report nutritional epidemiological studies and assume causation and that sort of thing, and it kind of sends people in 1,000 different directions. So I feel like we need to incentivize science communication in academia to help solve that problem.
So we did I came to Tufts 4 years ago, and our school is just 1 mile up the road. So for the BU faculty, we welcome collaborations. But I came to Tufts 4 years ago, and one of the first things we did was launch an in-depth strategic plan. And of the 14 goals, 3 are really highly germane to this conversation and to what we did next. So the top message we got from all of our external stakeholders was that the school needed to be a trusted voice to clear up this confusion, that we were one of the premier institutions in the world, and that we weren't taking an active role to engage with media and industry and the public. And so we were really trying to take an active role to be a trusted voice. And that's unusual for an institution to do, because our income comes from tuition and research, not from communication. And so we're trying to change that. The second related piece was that as an institution, we need to focus on public impact. We can't leave public impact to individual faculty efforts. Faculty are always out there trying to work and trying to have public impact. The institution's just hanging back and saying, faculty do your work, we're the institution, we have no opinion. We wanted to take an active role, and so that meant working with Tufts University and our legal counsel and a range of other issues to generate a institutional public impact initiative where we're hiring new faculty, professors of the practice, we're making trips to DC, we have an agenda, we have a food as medicine agenda that we're promoting. We've had great successes in 2018, which I'm happy to discuss. It was one of my slides just so far. And so I think institutions public health institutions need to have public impact, and for that to be more than kind of a bumper sticker, right? It's actually transformational, because right now academic institutions don't have staff, budgets, or funding for that. So we have to completely change how we recruit people, where we get funding from, and what we do. And I'll have to say, in approaching lots of foundations for funding about this, they all love the idea, but so far, we've had a lot of discomfort in funding it, because they're just, well, this is great, but is this really what academics are supposed to do? They get confused. And then the third thing, I think, specifically with regards to industry, both behavioral industry and food industry and insurance industry, is we got a lot of feedback from our students that they care about industry and the positive role of industry and want us to engage more with industry. And so we're launching a food and nutrition entrepreneurship initiative, which includes a food innovation council, kind of like MIT's Media Labs, but focused on food and nutrition innovation. We have an annual competition. We have links to accelerators and a range of a growing panel of sort of blue chip entrepreneurship advisors. So again, we want to have, there's billions of dollars being invested in food and nutrition innovation, and it's not science-based. And so we want to be there to be that science-based, both in our graduates and our current work. So I think that, to me, those are the three ways that academic institutions can become more relevant for the future, is really engaging to be trusted communicators, echoing the comment that was made, having public impact initiatives at an institutional level, and I'd be really interested to know what BU is doing in that realm, if anything, and also engaging with the innovation that's going on with companies.
Could you divulge the financial incentives of what you're doing with John Hancock? I mean, wasn't that one of the issues besides the impact that you're going to have with their current population?
So absolutely. I mean, absolutely. One of our incentives was to get a gift from John Hancock, and they do give us a gift. It's a gift. They give us marathon bibs. That we have a Tufts marathon team, and we raise money for that. They give us some funding to support a faculty council called the Nutrition Advisory Council, which does the work I mentioned. The webinars, the talks, other things, and they give some funding which supports students and helps us support students. So, that's absolutely critical. We wouldn't do this for free. I mean, we wouldn't be able to do it for free. And so I think that's a win-win, where we're getting a financial incentive. Now, does that mean that I may speak more favorably about John Hancock than if we weren't getting that funding? Sure, of course I probably would, because I know them, I know the people, I believe in their mission. If I met them and I knew them and I got to know them and I didn't like them, then I probably wouldn't work with them anymore. So I think we have to remember that as academics, that there's this sort of personal bias of getting to know people. I think that's, to me, the more insidious potential bias than the money. I can take money from somebody and not like them and not care about them, and that's not going to bias me very much. But if I meet somebody and have dinner with them and meet their family and they're the CEO of a company and I believe in what they're doing, that's a friendship. And so I think that leads to a bias that we always have to be aware of. Yeah.
First, thanks to both of you for great talks. I learned a lot. But I'm really quite surprised that education wasn't discussed. I didn't hear that or the school systems mentioned even once. By the time people are adults using the fancy apps, they've got very ingrained set of habits around how they eat, very influenced by adolescence. Isn't the real agent of change to work with children very early?
I'll start maybe. So I think education is dramatically overestimated as a potentially impactful field for public health. We didn't need education to handle clean water, clean air, occupational safety, worksite safety, the safety of the chairs you're sitting in. They all have standards, safety for toys. And I think that tobacco is a great example where just education alone would have had very little impact. So I actually think the major role of education is to raise public awareness, to activate policy change and move industry and create innovation. I think education has a role, but not, I think the food system should just be healthy and all the choices should be reasonably healthy, just like most cars are reasonably safe and you buy a phone, it's not gonna, blow up, right? Food should be reasonably safe. And so I think, systems changes are what's needed. And I think the real role of schools is school lunch and procurement and what's served. And there are studies on this. I mean, education alone, education by itself has very little behavioral impact. I don't know what you think.
Yeah, I would agree with that. Education alone does not have impact. More behavioral structural programs around children, I think, would be more useful. I know this is your lane, so maybe you want to say something about that.
School gardens, that's
Right.
different than education alone, like where kids
Yeah.
work with food and cook. And I mean, there's things that work, but just not pure education. So.
And a lot of the school-based interventions actually haven't been that impactful, unfortunately. Probably for more reasons than we can get into, but that's sort of been a bit of a disappointing area. I'm not sure why.
Right.
So thank you both very much. It was really interesting. So a couple of comments. First of all, I want to echo the Mozaffarian's comment about non-financial conflicts, because it hasn't come up yet today. Full disclosure, I actually published a paper called Non-Financial Conflicts of Interest, which for those of you who read it, you should also read the rebuttal that was published against it, somebody who disagreed with me quite strongly. But I actually think we, in the academic world, we take an easy way out and say that conflict is all financial. I happen to agree that there's more conflict that's non-financial than financial. So just labeling that. The second one is I was wondering if you can both guide us a little bit. I mean, hearing you talk, and the Mozaffarian's first slide said, food is responsible for more morbidity than anything else. And at the same time, there hasn't been really that much of an undercurrent of skepticism from either of you about industry academic collaborations, while in the previous two panels there was substantial skepticism. So why is that? I mean, sitting here objectively, I think I can construct an argument that says that the food industry is responsible for more morbidity and mortality than the previous two industries we talked about, but there was skepticism there of working with industry. Well, here, I'm not saying there isn't, but there clearly is less so. So I'm just wondering if you can guide us through, from your perspective, why that is.
You want to start? No.
Sure. I mean, and I think you mentioned this a little bit, but the food industry, I feel like, is very different than tobacco and alcohol because it's not one thing; it's so many things, and so it's not like it's all bad or all good. Maybe it's not quite as dicey. That being said, for me personally, I would have to think very long and hard if I wanted to get into a relationship with Coca-Cola Company or certain companies that are promoting products that are responsible for a lot of the problem. But so I think it would just sort of depend on how willing they were to actually be responsive to the science around it. But so I think that some of the same issues are there that apply to the other companies, but maybe it's just a little less black and white.
Yeah, so I'll echo all of that. I think that there's enormous problematic elements of the food industry right now and huge challenges, and there are certain companies that we probably would just say no to based on face validity alone. Whatever the project was, I think I would tell our faculty member I really don't think we should get that funding. And a lot of food industry is using the same tactics as tobacco has. And if people didn't hear the American Beverage Association sort of extorting the entire state of California to preempt local soda taxes a few months ago was, I think, one of the most horrific sort of episodes in our democracy, actually. You should really look at what they did. So I think there are horrible things that food companies are doing. But I think the difference is to tobacco and to alcohol is that we need food every day, 3 meals a day and snacks, and we need the food industry to make that food. They have incredible technology and skill and scale, and they're incredibly heterogeneous in terms of what different companies are doing and different people within different companies are doing. And most importantly, compared to 10 years ago, they're at the table because their sales of their previously trusted brands are dropping, right? The 90% of growth in the food industry is all small upstart companies that are at least selling the aura of health and transparency and sustainability. And so I'm not worried about the food companies not changing. They're changing. They're changing right now. They're all talking about a food revolution. What I'm worried about is that the change is not going to be evidence-based. And so we're going to go from Doritos to Cool Ranch Doritos, and from gummy bears to organic, non-GMO gummy bears. And I use that example because there's a major startup that's promoting that in a national campaign, that we're selling organic, non-GMO gummy bears, and it's healthier. So I think there are lots and lots of challenges and lots of reasons to be skeptical, and specific companies to avoid with a 10-foot pole. But on the other hand, our graduates are going into these food companies. They want to make a difference. There are people in these companies who want to make a difference. And so, in contrast to tobacco and alcohol, the food industry can be profitable and sell healthy food, and it's a win-win.
And we have time for one more question.
Thank you both. This was a very fascinating conversation. So I'm actually an occupational health physician, and I deal with a lot of employee health. And I've worked in both academia as well as in corporate America. And at least my struggle when I was in corporate America was trying to get CEOs and CFOs to get in on investing in employee health. I feel that's a very hard sell. Obviously, with you, Dr. Mozaffarian, you've had some pretty good success with John Hancock. If you can give us some takeaways in terms of, how do you engage CEOs, CFOs, how to be able to get them on the employee health bandwagon, that this is a worthy investment, and you can actually demonstrate the ROI as well as the value to the entire corporation. Thanks.
Yeah. In our Food is Medicine platform that we're promoting in DC, one of the 6 pillars is worksite wellness. And so worksite wellness is absolutely essential, and just like school wellness is essential. And BU is actually partners with GE, which is one of the companies that has recognized this and made a big deal about this because they saw that double-digit rises in their healthcare premiums. Warren Buffett, during the tax cut, during the Republican-Democratic battles over the tax cut last year, said in the New York Times that American business doesn't need a capital gains tax cut. We need help with healthcare costs. He said healthcare costs are the tapeworm of American competitiveness, and food is what's feeding that tapeworm. So I've actually found, I don't know when you've talked to companies, I've found enormous interest from all major companies, whether they're self-insured or have outside insurance, in employee wellness. Almost every conversation we've had actually with major food companies about research or other things, they all say, and we really would love your help in thinking about employee wellness. So I think there's enormous potential there now that wasn't there even 5 or 10 years ago. And what we need to do is to give them platforms that are effective and show that they're cost effective. And I think that's what's missing, is the cost effectiveness research has not been done to show that these things save money. Life insurance is a little bit easier because you have a policyholder for 30 or 40 years. The average job might be 3 or 4 or 5 years before people move on, and so you have to show the work site that you have to show the employer that they're going to get return on their dollar within a shorter amount of time. Food and tobacco and physical activity and alcohol cessation all work really quickly, actually, all work within months. But for some reason, there's a perception that they take a long time. So that's that. So I don't. My sense is that it's coming, and the questions are there, but the solutions, we don't have a neat package to give them and to say this is exactly what you need to do.
Yeah, I totally agree with that. The only thing I would add is part of the skepticism might also be that initial programs that are out there haven't been shown to be very effective. And so that's just going to make matters worse if they're coming in already skeptical. So back to your comment about needing cost effectiveness data as well as effectiveness data at the very least, I think is going to be really important.
Great. Thank you so much to our panel.